like to welcome Jaime and Judy, and this is one of the series of Zcast that we're calling them. That they're just more informative. I know that during the course when we talk to clients, many different things come up, especially our elderly clients that have reached the age of 65. It becomes an issue when they've got to start start enrolling into this thing called Medicare. But first, let me have you guys introduce yourselves.
Judy, good morning. My name is Judy Naranjo. I am based out of the San Antonio IWC office, and I've been with the company for about 15 years.
Yeah, a long time. So
a long time. And I wear different hats, and one of many is Medicare. I represent Medicare as far as, me being able to sell it. And it's been a really satisfying challenge because it's just a topic that's so complicated. So I really enjoy researching things for clients and making sure that they are well educated so they can make the right decision that's based on their situation specifically. And my partner here, Jaime.
Hello, my name is Jaime Cavazos. Thank you, Judy and Albert. I'm also here out of the San Antonio office. I work out of both the Edinburgh and the San Antonio office. I'm a wealth consultant, and I also help clients enroll in Medicare.
Good. Thank you. And right now it's hot in both places, so it's just burning. So it's, but we got into Medicare, and kind of our business got into Medicare kind of I don't know if it's called by mistake, but like many different things out of necessity. And it actually happened to my mom. So my mom calls me one time and says, Mijo, somebody called me and said that they wanted to see my Medicare card. And I was like, please tell me you didn't give it to her. Of course she did. And so before she knew it, they had changed her to another Medicare provider. And so she said she was very upset. And so she ended up getting it back where she wanted it. So I thought that was really weird. Like, people were calling and actually changing on Medicare. And so I know we do financial services, and we do have an insurance branch that we do offer other types of insurance, but Medicare was really not one of them. And it so happened in that same week, I was doing a portfolio review with a client, and sure enough, he had turned 65, and he said, I get bombarded with, Medicare and just they keep trying to tell me these things. And he goes, I'm really confused on what to do. And I said, well, what'd you do? He goes, I chose this one thing just because I had to. And so from that, I felt like, we needed to do something, for our clients. And that's one of the reasons, I reached out to Jaime initially. I said, Jaime, what is this Medicare, and how do we get involved in it and all this? And because we never really were involved in the Medicare side of it. It was more, we allowed everybody else. So I thought it was very important for our firm to at least educate our clients on what Medicare was about and what it could do. And I had the other day an engineer that Jaime helped us with that he was confused about all the different options in it. And he's an engineer, so it's not to be thought of as something that's easy to understand. But let's kind of back up a little bit, because let's talk about two things. I know there's a lot of confusion, because I still hear people that will say that, oh, I got to get on Medicaid, and they get those two confused. So can you explain maybe what the difference is on that, to help people understand what's the difference between Medicare and Medicaid?
Yes, I can answer that. So Medicare is not Medicaid. They both pay for healthcare, and both are government programs. But Medicare is for people who are older and disabled, and it's governed by the federal government. While Medicaid is for people with limited income and resources, and it's a program governed by the states. two separate.
Yeah, so so Medicaid is based off of income and necessity as opposed to Medicare. You know, you turn 65
Or
and you're required or disabled. Yeah. So
Just
so you're
remember,
able.
Medicaid, the state gets involved.
So are you saying also that like someone, how old can a person, you said disabled, so a person can get on Medicare at what age? Like 30?
yes, yes, under 65, any age, they're automatically enrolled after the 24th month of disability.
Okay.
Now, this
And
is Social Security disability.
Social Security disability. Okay. And so so now going on to the topic of Medicare, because it is required, I know that, we've got clients that are still working and, that they're 65 and they may be covered by another plan, which maybe their current employer, or if they have their own business and if they provide health insurance to their employees, are they required to stop using that and get onto the Medicare plan, or how does that work?
I can answer that. They do have a decision to make when they turn 65, whether they want to stay on their employer plan or they want to get off their employer plan. But Medicare gives those beneficiaries turning 65, they give them the opportunity to delay enrollment in Medicare without a penalty if they have employer provided health insurance, either through themselves or through their working spouse. And Medicare calls it credible. So credible coverage is considered an employer sponsored group, I believe. If it's group coverage, either covered by yourself or your spouse.
So you said
As long as
something,
you're covered somewhere, you won't be penalized.
well, and
So a group
that's what
employer.
that's what I was gonna ask you about the penalty. So, uh, a person turns 65 and they're like, I'm not gonna get into that. Are they getting mail? Are they getting correspondence from someone that's saying, hey, you need to enroll into this thing, or is it supposed to be they know that you're supposed to enroll? I mean, how is this? How is the how are they? How do they know that they need to enroll into this thing?
They won't, if they're on Social Security retirement, they will automatically be enrolled at age 65.
Okay.
So if that benefit, if they are also working and have group coverage, they need to notify Social Security, hey, I'm going to delay Part A and maybe Part B. Most people go ahead and get Part A if they already have their 10 years of paying, since it's no cost for Part A, but they can delay Part B if they're going to still be working. So in other words,
I'm sorry, let's clarify Part A and Part B. A lot of people are confused with Part A and B. Part A is anything related to you being in the hospital. Part B is anything related to seeing a doctor, paying, when you go and see your physician at a doctor's office. Depending on the plan, that may come with a prescription plan. Again, it all depends on your zip code where you live. So it's very important that you talk to someone first. Just two little comments on your introduction, Albert. The biggest takeaway, I think, from this is that don't give anybody any information because you will get a lot of phone calls and a lot of correspondence. Don't give any information to anybody. And it's very important. You mentioned that we had a client that he just picked whatever. That's also very dangerous, because on some option that you have when you're barely turning 65, if you choose something else and not that was your only chance of picking that particular insurance product without any underwriting. So once you pick something, you can say, oh, well, I really would like this other one. Well, if you do it later, you're going to have to go through underwriting. So it's very important that you just not say, well, for now, I'm just going to pick something, because you're going to miss out. If that plan is right for you, that's your one opportunity of getting that. In this case, it's called a supplement. So it's very important.
Well, that's very, very important to that, that you understand that. I mean, because I think that most people don't know that, and they're just going to grab something like you said, and just say, you know what, and then they're stuck with it and so you're saying that they actually have to go to underwriting, which means that can they refuse them, or what happens then? Does
They
Medicare
can.
premium?
They can. They can refuse them.
Oh,
So, but you won't get refused if you do it right before you turn 65. That's the only time where there is no, no checking of anything or any questions asked. You can get in then. And a lot of times these people that are calling, all they're wanting to sell you is a specific plan that everybody gets, a Medicare Advantage. Okay. So they tell you, don't worry about it. You can switch later. Yes, you can into another Medicare Advantage. But if originally you wanted a supplement, which is something totally different to Medicare Advantage, you only have that one opportunity to do it. So it's important. Again, they tell you, they, meaning these people that are just looking at lists and just calling people, they want to make a sale.
they don't
It's
care.
really sad.
Yeah.
But it's so important to say, well, let me get something now and then later I'll switch.
Yep.
So, and then if they are not, if once they turn 65 and they're not on Social Security retirement, they will not be enrolled in Medicare. They would need to enroll themselves. So only those that are on Social Security retirement will be automatically enrolled in Medicare.
So let's take this example of this client that did choose just whatever, and now they kind of look at it and say, they went to the doctor, they didn't really like their plan. So when can they choose to get onto a different plan?
So when they're 65, there's a 7-month window where they can enroll, 3 months before their birthday month and 3 months after their birthday month. They can enroll into Medicare. And during that same window, they can enroll in additional coverage, which Medicare doesn't cover. So original Medicare only covers Part A and Part B. Like Judy was saying, Part A is for inpatient care and Part B is for outpatient care. That's the only coverage you get with original Medicare. There's no prescription coverage. So that's a supplement you would get. That's considered an additional coverage to pay for prescriptions. And you have two other options. You can get a Medigap, Medicare supplement insurance to cover costs not paid by original Medicare, or you can get a Medicare Advantage plan that combines Part A, B, and D prescriptions into one plan, and it has additional benefits like dental, vision, and over-the-counter credit to buy health products.
A Medigap plan is the one I'm telling you, where if you get it before you turn 65, that's the one opportunity that you can get into a Medigap without any underwriting.
Gotcha.
If you get a Medicare Advantage, we have different windows during the year. Like we're going to come up into an open enrollment period right now, October, where you can change within the Medicare Advantage from one to another, but you can't go like from a Medicare Advantage to a Medigap plan. I mean, you can, but you're going to have to go through underwriting.
Wait a minute. So you're saying that, okay, say that again. So you're saying that,
sure.
So if you're in this Medicare Medigap, and now you want to go to Medicare Advantage, and it's in an enrollment period like October that's coming up, you've got to go through underwriting?
No, not when you go into a Medicare Advantage. The Medigap is the one that it usually is kind of pricey, and that's why you have higher premiums on a Medigap. That's why you can only get into a Medigap one time without underwriting, and that's right when you're turning 65.
But Judy, they're pricier because they offer more services,
more benefits. They're less restrictive. A Medicare Advantage is a pool of people where they're sharing the cost, okay, of your health care. You have to get referrals from your physician if you want to go see a specialist. There's more restrictions there, but
Mhm.
you don't, there's some Medicare Advantage plans where you don't pay anything. And again, it all depends on the person. That's why it's so important to get all the information. You can't assume that someone can afford a Medigap or cannot. You have to educate them on everything. That way they have the choice and they know what to expect. A lot of people are fine with Medicare Advantage plans because they know that they're more restrictive. They have to get referrals for specialists. The physicians have to get approvals for different exams. It takes a little longer, and you have to be a little bit more patient when you have a Medicare Advantage. A Medigap, you're in charge. You and your physician are in charge of your health care. You don't have anybody telling you you can't do this, you can't do that. You can go see whatever doctor you want, whoever does accept Medicare, of course. So you have a lot more freedom, and that's why it's a little bit more. It's expensive. It's more expensive.
So we have clients that, of course, they've worked really hard to save a lot of money for their retirement so they can enjoy. And one of the things that they like to do is travel. And if they're on Medicare and let's say that they're just traveling, and you said something was interesting. You said zip code, which I want to get to. However, if they travel, like let's say they traveled in the States and they're in Texas, but then they go to California and something happens to them where they need services, is their Medicare plan covering them for that, or they're saying, well, that's
Yes, you can be seen on an emergency basis.
Hmm.
So, for example, my mother visits me from Houston. Well, she can't see a doctor here, like go to the clinic and be seen. She can only go to an emergency room or an urgent care for their insurance to cover it. She can't say, well, I'll go to the clinic and be seen here. You can't do that. On an emergency basis, you can. Even internationally, you can be seen on an emergency basis.
So it's interesting because it's a national health,
Judy,
insurance.
that's for Medicare Advantage plan, right?
Your Medigap also.
Your mom has a Medicare Advantage plan?
My mother has a Medicare Advantage plan.
So that's for Medicare Advantage, Albert, but for a Medigap plan, you can. All you have to do is go anywhere that takes takes original Medicare, and they pay for the 20% that
Medicare
doesn't pay for. Oh, it's very similar to HMOs versus PPOs for health insurance.
That's Medicare. You just described Medicare Advantage.
Okay.
So if you have a Medicare Advantage plan and it's a PPO, you can go outside the zip code.
Got it.
But if you have an HMO, you have to stay within the zip code.
You've got what's called a gatekeeper.
Yeah.
Gotcha.
And that's where the zip code comes into play. Because that is when we have to, if they have an HMO, we have to make sure that the physicians that they're currently seeing, if they have a Medicare Advantage, and if they're thinking of changing for one of many reasons, that's one thing Jaime and I do. We make sure that the physicians that they're seeing will be covered in their new Medicare Advantage plan with the HMO. We want to make sure that they continue seeing the physicians they're used to seeing. So it's really important.
So Medicare Advantage plan, you have to be within the carrier's network.
Right. So going back to the zip code on that, so is it possible then somebody from Texas where you got maybe more obese people, and there's another zip code that maybe that zip code they're a little healthier, maybe. I don't know if that's true. Is it possible for those two zip codes to be paying different premiums?
Yes.
For the same service? Wow.
It doesn't, it's not depending on, the majority of people are obese or not, or these people have diabetes, or it's also physicians' choices. The clinic chooses what insurance they're gonna cover. So we want to make sure that whatever insurance they're getting, the physician is one of the approved physicians in their plan.
do all physicians accept Medicare insurance? As you
Majority
know,
do.
majority do.
Some are going to cash only. This insurance
Hmm.
thing is getting so complicated, but right now the majority, yes.
Mhm. So going back on the enrollment, you mentioned the penalty. So let's say that this person, turns 65. They never gave him a call, and then they kept going, and then now they're 67 years old. Um, and now they need to go and enroll, and primarily because they're having maybe they got sick or they've got to go to the hospital. What happens then? You know?
Yes, when they enroll in Medicare, there's a penalty for every month
Mm.
after they turn 65. They would have to pay a penalty for every month
After the 3 months that the
Yes.
enrollment, or is it? Oh, okay. So
And it's an
then,
ongoing fee. So it's not like a one-time fee and then you're up to date.
right,
That
but
fee will be charged every month going forward.
right, yeah. So it's pretty hefty penalty, and so, but I'm assuming that they would not have underwriting; they just accept them at that point.
Yeah, Medicare Advantage,
Only.
there is.
Yeah, a Medigap, there'll be, when you get a Medicare plan, there's always underwriting when you're not within your window of turning 65.
Mhm.
But Medicare Advantage, there is no underwriting.
Right. And the fee, it's minimal, but it's a fee, and it's ongoing. You never stop paying it.
Mhm.
It's every month going forward, so it's very important.
What if I mean, how do they determine? What if a person can't afford paying, for the Medicare, if they can't afford the premiums? What happens then?
Well, we have in those cases we do have Medicare Advantages, Medicare Advantage plans that have a zero premium.
Hmm.
So there's plans that you can look at.
Mm.
Now, Part B, putting that aside, Part B isn't free. So you have to pay Social Security on for Part B, which covers outpatient. And so the rate for Part B is $164.90 for the year 2023 for most people. Now, if you make more than $97,000 individually, then you're going to pay a surcharge. So it costs a little bit more for those that make higher income.
Mhm.
Nobody escapes paying Part B.
Now, if back to your question where the people are limited income, most people with limited income qualify for Medicaid. So they have both Medicare and Medicaid, and Medicaid pays the Part B for the Medicaid patients, the monthly premium.
Interesting. Well, this is as you've explained, and it can be very confusing. And so, and that the client that you had, they've had charts and everything. Of and they're like, I give up here, and it's good to know that you guys at least are here to educate clients on what coverages on that it may or may not cover, because it's important that it's not just like that client that we talked about just choosing anything and then realizing that it's not what they were looking for, or they may luck out and it was the thing that they looked
Right.
for.
Something in staying within the same subject that you're talking about. I forgot what I was going to say.
Yeah, well, I mean, it's
Oh, the
confusing.
language barrier. I was going to say, a lot of people find this very, very, very confusing in English, and they speak English. Imagine a Spanish speaking person, it gets
Mhm.
even more complicated.
Sure.
In our team, Jaime and I work very well together, and my first language was Spanish. So anybody that needs help with Medicare in Spanish, everything will be explained in Spanish. And that's
Excellent.
I either will translate for Jaime or I will talk to the clients. But I speak fluent Spanish. All we need is a phone call.
And I understand, as I understand, we're going to be doing another interview in Spanish. So
correct. So look out
I'm,
for that video.
Yep. So I'm going to have to sharpen my Spanish. So get ready. Well, good. Before we end this, just is there anything else that you'd like to add to about Medicare and what would you advise anyone that's just going to enroll into Medicare?
Just a reminder that the annual enrollment period is coming up October 15th to December 7th. So that's the annual enrollment period for you to make any changes once for those that are already enrolled. And then another enrollment period is for those that are turning 65. There's that 7-month window, 3 months before and 3 months after. And then the last enrollment period are for those that are delayed at turning 65, then they get their own special enrollment period once they retire or they lose their employer coverage. So just a reminder on the enrollment periods.
Good.
My recommendation would be not to panic. Just it will all work out, but what's important is that you speak to an agent that will educate you. You need to speak to someone that will not tell you what to do. They need to educate you and explain to you, how one works versus the other. And then, sure, we help people decide, but it's their decision. But don't panic. It is very complicated, but that's why Jaime and I are here to help.
Excellent. Well, thank you very much for helping us and educate our clients and anybody else who needs the education. And hopefully this video, did anything, show that you do need some guidance in making the choice that we do have the resources to do that. So thank you very much and have a good day.
Thank you, everyone.